Part 2 on what I've learned about endometriosis surgery from my private consultations with 2 endometriosis specialists, recommended as the best in the UK, and a colorectal specialist. And I'm going to treat you to some more science ed via diagrammatic explanations. Last week, I spoke about the surgical removal of endometrioma and the impact it has on egg reserve, on fertility. Today, I'm going to share what I've learned about excision surgery for endometriosis when it involves removing endometriosis from various parts of the body. As we know, endometriosis can literally grow anywhere. It can grow on any organ, nerve, ligament, anywhere. So what happens if you have endometriosis in your pelvis, say your bowel, and in your upper abdomen, say your diaphragm or liver, and you're due to undergo excision surgery? Is full excision surgery possible? Can the surgeon and his team treat all of your endo? The simple answer to that is yes and no. Both of the consultants explain that in the case of bowel endometriosis, which is what I have, which is what many of you have, it is probably the most common form of non-reproductive organ endometriosis. That full excision of all endometriosis within the pelvic area and abdomen is highly dependent on the type of bowel surgery required. What kind of surgery is required to excise, to remove endometriosis lesions or nodules from the bowel? If you have endometriosis lesions or nodules on your bowel, there are various forms of surgical treatment for the removal of disease. 1, bowel shave, 2, bowel disc or discoid resection, and 3, bowel resection. What's a bowel shave? Let's get into it. Here is your bowel. A bowel shave is required when an endometriotic lesion or nodule is sitting on the surface layer of the bowel. It hasn't penetrated the bowel wall. A skilled surgeon can cut it out without having to cut into the bowel. This is the least invasive type of surgical treatment. On the other hand, a bowel disc may need to be performed if an endometriotic lesion is less than 3 centimeters and it's somewhat penetrated the bowel wall. A small part of the bowel wall is removed, a disc, and the gap caused in the bowel through the bowel disc removal is typically patched up using staples. Moving on to bowel resection. Bowel resections are typically performed when the endometriotic lesion or nodule is greater than 3 centimeters and or has penetrated the bowel wall. And in some cases, the lesion or nodule has caused an obstruction because it's grown that deeply into the bowel organ. With the bowel resection, the diseased part of the bowel is cut away and then the healthy parts are sewn back together. So those are the types of bowel surgery. What has this got to do with surgery involving removing endo from the upper abdomen, you ask? It's all about risk assessment. In order to perform safe excision surgery from the pelvis through to the abdomen, the surgeon needs to ensure that the risk of complication is low. Where the bowel is involved, if a resection is required, there is a higher risk of complication. Typically speaking, bowel breakage, bowel leakage. If the bowel were to leak, there is a risk of affecting other organs. I'm talking infection and even organ damage. So the endometriosis specialists advise that if they need to perform a bowel resection in order to mitigate risk, they won't operate on endometriosis found in the upper abdomen. However, if bowel endometriosis only requires a bowel shave, then together with a specialized endometriosis surgical team, and upon review of all other risks, they should be able to treat endometriosis and excise it from the upper abdomen, whether it be on the liver requiring a hepatologist or the diaphragm requiring a thoracic specialist. The risk of complication is much lower with the bowel shave. And so, if in competent expert hands, the surgical team should, in most cases, be able to handle full excision of pelvic and abdominal endometriosis. Then you have VAT surgery, video-assisted thoracic surgery, for treatment of endometriosis within the chest cavity. Now, one of the endometriosis specialists I saw said that they wouldn't advise doing both laparoscopy surgery and VAT at the same time, due to the intensity and the high impact of both procedures plus recovery. The other specialist advised that they had performed both surgeries at the same time when it was safe to do so. VAT is so much more complicated, but that's a topic for another day. So, have you had endometriosis removed from both your pelvic area and abdomen? Please share your stories in the comments.